Welcome. Come with me. The doctors will see you now.
Welcome, everyone, to Fast Talks with Family Docs. I'm Dr. Virbadala, again, soloing this endeavor without my partner in crime, Dr. Philip Palmer, who we miss dearly. But we are still joined by the Dr. Steve Crawford, where we're talking about all the changes that are happening around vaccines lately and what we as family docs or healthcare professionals in general can do to help our patients moving forward. Dr. Crawford, thank you again for joining us, sir.
Thank you for the opportunity.
Oh, not a problem. From our conversations, we talked a little bit about this. I think both of us have seen this. There's a lot of vaccine hesitancy now, and it definitely hasn't gone away, but in some ways feels amplified. From your perspective, what can we do as healthcare professionals to kind of rebuild that trust with patients or families in this environment?
Certainly. Well, I think the first thing is to care about your patients, to know that they're fearful when they sometimes come with these questions. They have a fear, and don't belittle that fear.
Yeah.
Know that the patient or parent has legitimate questions or concerns. Even those that may be even staunch anti-vax may have some fear that they have a friend or relative that claim they were harmed by a vaccine or have read about it, and it makes them concerned. And they've gotten online and went down the rabbit hole, unfortunately, that you can find the way the internet works now and kind of feeds those fears. But if you can establish a relationship, if you have one, if you don't have one, establish that trusting relationship with your patient. It may not be an immediate success, but over time, I think for many people, if you do establish a trusting relationship, you can sway many people's opinions. Mm-hmm. Tell them what you do for yourself and your family.
Yeah.
If you are older and you have grandchildren, what you recommend for them, and maybe some personal experiences you've had caring for people with vaccine-preventable diseases. Even though it's not a study per se, the case study, as clinicians know, giving a patient in a patient's language a case study of a vaccine-preventable disease that you had to care for sometimes can be very helpful.
Yeah.
Again, this takes time. I think the other thing that I've heard recently, and I've heard it before, is making sure your staff are educated and appropriately vaccine supportive in their language.
Right.
It can be very subtle. It could be that, as was actually I heard about this weekend, one of the people I work with in regards to vaccine advocacy took her teenager to get his second doses of meningococcal vaccine.
Yeah.
Doctor recommended it. She was ready to give it. She's a strong vaccine advocate. But the nurse said, "Are you sure you want two at the same time?"
Oh, man.
And the issue is, as we well know as clinicians, it doesn't matter. You can get 2, 3, 5 vaccines. Even though that's multiple shots, there's no harm to a person in getting that other than a little bit more soreness in the arm. So this particular vaccine advocate parent who is taking her teenage son to get his appropriate vaccines got not a negative message, but a hesitant message about getting appropriately vaccinated. So educating your staff, having appropriate educational material, and then become an advocate in your community too. Give talks to local social clubs like Rotary, Lions, whatever. Talk at your church. Have an educational session at your church or place of worship. Do it at other schools.
Yeah.
that would maybe have an educational night and offer yourself to give that type of information.
Yeah. Yeah. And I love that you brought up, taking the time and building the trust with your patient. Because I think in the end of the day, we're human too. And I think if we open up about that and kind of blur that line just a little bit between patient and physician and show that you care.
Yeah, I mean, you don't come in and you say, "You idiot."
Yeah.
The data's there.
Yeah.
Well, it is, and it's obvious to me, but it isn't obvious as to this person that's asking the question, and they're fearful.
Yeah.
And we don't treat fear by belittling it.
Yeah.
I guess that's the ultimate. We don't want to belittle their fear.
Right.
Fear is real for them.
Yeah.
And we need to make sure we figure out a way to help them understand and assuage that fear.
Mm-hmm. Yeah. And you mentioned advocacy and advocating, whether it is like for your community or through the community, and with your work with the Alliance of
certainly
of Healthy Families, and then you're currently doing a lot of vaccine education already, and then working on policies. But in addition to like being a member of the community and educating our community, what are some other ways you think people that haven't fully involved themselves kind of in this situation, how can they get involved? Like, how can they go talk to the leaders?
Certainly. Well, the first thing that I always tell people when we talk about advocacy is first, make sure you're registered to vote.
Exactly. Okay.
Number one.
Number
2, know who your legislators are.
Mm-hmm.
If you don't know who your legislators are, you can actually probably Google, find my legislator, and what you do is you put in your address on those web pages, and they actually tell you who your local legislators are, your state senator, state representative. They'll tell you who your congressional representative is, congressperson, and then who your senators are, who your governor is. You may already know that, but it also gives you usually contact information. But I would encourage those who've not done it is to contact their legislator, even go up to their office and meet with them and just say, "Hey, I'm in your district. I am a physician. You may not know me, but I want to let you know I'm here. I would love to tell you about myself and what I'm interested in." Doesn't have to be about a specific bill,
right?
But just say, "I'm here. Here's my number. Call me if you have any questions." Because legislators, they have their own area usually limited of what they're experts in.
Right.
They don't come as legislators. They don't go to a school of legislature.
Right.
Some are attorneys, some are farmers, some are insurance salesmen, some are car dealers.
Yeah.
Who knows? But they have to go from learning about prisons to teacher retirement to building data centers and all things in between, let alone healthcare concerns. So they, I think would welcome the opportunity to hear a trusted voice that they believe they have. And if they have questions, you just give them the opportunity to call you.
Yeah.
And I think that starts that relationship. You don't have to give money to them. You don't have to, if you feel, like you want to, you can. But that's not what they're really looking for many times. They're really looking for the opportunity to connect with their constituents, those people that are in their district. They want to hear from them. They want to know what you're concerned about. But they also may want to know when it isn't, the bill bearing down on a particular vote. They want to, just have the information available. So,
yeah. I got to share something with you today,
Sure.
sir. Like I told you this, but I had the privilege of being the doctor of the day today.
Yes.
And with the state
and thank
capital.
you for doing that.
No, thanks, sir. So for anyone who are physicians who are listening, Doctor of the Day is when you get to go volunteer.
By the way, I want to tell you something historical about that.
Yeah.
The Oklahoma Academy of Family Physicians started the Doctor of the Day. You knew that? Okay.
Yes,
I didn't know if you knew that.
Yeah. No, it's I heard all the the story
history
behind it, inspiration behind it, and because the nurse that's always there, Miss Susan, was telling me about it.
Good for her.
Yeah, she was had a lot of fun hanging out with her. But Doctor of the Day is when you get to go volunteer and be the doctor during sessions in case something happens. But the really cool thing is you get to actually go meet your legislators, and they introduce you, and you get to like watch them debate. And Dr. Crawford's right. It's as easy as typing it in Google to figure out who your legislators are. And we all are doing our own thing and trying to get through clinic and take care of our patients. And some people don't even know, right?
Right.
And I want to bring this point up because when I was sitting there listening to the debate on the floor, a lot of stories were like, I was talking to one of my constituents, which I was like, whoa, because so real people, these are all real, and regardless of like, we think many people, in politics, like, hey, we can't approach them, but they're people, and they're easy
people of our
community, and they're talking to constituents and bringing those conversations to this debate floor, and all I see is, regardless of their political affiliations or beliefs, passion in what they're doing.
Right.
And
they want to serve the people.
They want to serve the people. And literally one of the comments were, we have to know a little bit about everything.
Yes.
And just simply, I never know. Like you go meet your legislator and just sometimes you just simply show up and you build that connection that you're saying, and they might reach out to you as a contact and provide information. And that's a way we can contribute, I'm thinking. And that's what I did today, and I hope
those are those are the steps to take. Again, I encourage people who haven't to register to vote and vote when it's time to vote.
Yeah.
In Oklahoma, you can easily, because physicians are busy, to do an absentee ballot. You don't have to give a reason, and it makes it so you don't have to go stand in lines and vote, and they send you the ballot. You have to go through the rigmarole of getting it notarized.
Yeah. That's
the one kicker in our particular voting situation. But you get that done, you mail it, you're done.
Yeah. And so, like, I think I agree with you. I think that's a very good starting point, especially if we're hearing about all these vaccine changes and you want to give your opinion.
Right. I think, from vaccines to other health related, or even, if you have a particular interest in other areas, you can establish that relationship. Obviously, physicians hopefully are well versed in the science of medicine, and can give a appropriate scientific response or answer to questions. There on the other side, you may have a passion about other things too, that you've established those relationships too, that help maybe get in on those particular areas too.
Yeah. Like side hustles or
well, I'm thinking, conservation,
sure.
Or some people, docs or hunters, and wildlife conservation is an important aspect of having a good hunting environment or fishing environment. Those kinds of things. I bring that up because my brother is a big hunter and fisherman, and he certainly would be a strong advocate for those things. My dad was too, so I wasn't quite as strong as they were, but I've done those things and know how important the wildlife conservation is, though it's not something I'm an expert at in any way.
Yeah, but like it comes to the point that doctors are beyond our job. Some of the other interests and things we're passionate about.
Some enjoy other things too. You're not just a doctor all
24 hours a day.
Yeah.
Okay. Well, looking ahead, sir, what kind of gives you hope? Do you see a path forward that kind of strengthens vaccine confidence again, and building public trust again? Like, what gives you hope?
Well, I think that we have a very strong advocacy infrastructure, from our academies to organizations like the Oklahoma Alliance for Healthy Families. People have come together and appropriately have advocated for the science side of that debate. And they have advocated appropriately that we go down those paths rather than just an opinion-based world. So I think that's what I have hope that, and we've understood and had a kind of almost a wake-up call with when COVID hit. A lot of people, there was a lot of back and forth and a lot of debate on what to do and how to do it, and people were actually trying to fly the plane while they were building it because we didn't know what was the right answer. And so sometimes we went down the path and said things that were not correct. And that started doubting science. But that was science in action, actually.
Yeah.
Healthcare science in action being observed.
Yeah.
Eventually, we did get the right answers, and it came down that, certain things needed to be done to get that pandemic under control. Unfortunately, lots of people suffered and families suffered from that. And we also suffered, though, from having a rise in vaccine hesitancy and resistance. I think, unfortunately, we've had an outbreak of serious vaccine-preventable diseases. We've seen particularly measles, some whooping cough episodes or pertussis, and I fear that we may have other diseases that are going to start rearing their
comebacks,
heads. And with those, though, with the publicity of those, people are getting concerned and saying, oh, we thought measles had gone away. We don't need the measles vaccine. And this, by unfortunate happenstance and illness in some individuals and deaths, it may have kind of sparked the, it hasn't gone away. It's not absent. It can come back. And other vaccine-preventable diseases could rear their heads if we don't get on top of it. The other thing I like to always bring up that people don't seem to realize, particularly those sometimes arguing against, is that I believe vaccines are a national security issue for the United States. And why I believe that, if you go back to George Washington, he required all of his troops to get the smallpox vaccine. Smallpox was rearing its head amongst the troops, and he was worried that it would decimate the kind of frail army that he had assembled. It affected the British, so he was able to sustain his troops when the others couldn't. He made it a court-martial offense not to get vaccinated. Same thing's happening today, I believe, both on whether you're a military person, and people have heard, you go in the military, they give you all kinds of shots. But I think it's also a risk to our entire country if we have a vaccine-preventable disease outbreak like we're having with measles. We're having to direct financial resources. We're having to direct our nation's attention to try to address that health care concern, where we could be addressing other issues that are more pressing that could occur. If other countries around the world are vaccinating their populations and we don't ours, we take a significant national security risk, I believe.
That is fascinating.
Yes.
And
scary.
Yes. At the same, very scary.
Very much so.
Wow, sir.
It's kind of like, they threw the smallpox infected blankets over the fence at the Indians to get them infected. And unfortunately, that was kind of like tribal warfare
like biological warfare.
Biological warfare. We're kind of in a indirect biological warfare by not getting vaccinated.
Wow. Well, sir, lots to think about.
Yes.
But bottom line is we see hope that even though there is increase in cases that we see of viruses we thought have been eradicated, moving forward, there's a lot of people coming together and educating our population.
And I think there's been an uptick in people getting the measles
Measles,
that
yeah.
hadn't been appropriately. So,
Right.
so maybe it will sway the tide. We'll see.
We'll see.
It's going to take some time
Yeah.
to
We'll see.
change that tide, as it were.
Yeah. Well, Dr. Crawford, as always, such a pleasure to have you,
Thank
sir.
you.
And thank you for coming and always educating us and always having fantastic conversations with us and your leadership, sir. Really,
Thank you.
Really appreciate it. And to folks listening and watching, this once again been Fast Talks with Family Docs, and we'll see you on the next episode.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.